Oral surgery is really important when there's some sort of disease in the mouth, whether it's an infected tooth or maybe an infected gum. It's important to remove the infection or remove the disease, whether that's an extraction or a biopsy, that sort of thing. At Kennedy Dental, we're here to restore teeth and preserve teeth, but at some point there's a tooth that's unrestorable, and so the patient's better off not having an infected tooth that could compromise the rest of their health. So that's when oral surgery would come in handy. At Kennedy Dental, we perform many extractions all the time. We preserve ridge. We do ridge augmentation where we remove a tooth, we pack bone, we set that up for an implant later on down the road. We'll take out predictable wisdom teeth. We'll do a number of different oral surgery procedures here. Whenever I extract a tooth on a patient, I always say, it's a roller coaster of discomfort for a couple of weeks. So, you might be fine one day and then the next day you might be a little discomfort, but that's just the body healing where that tooth was taken out or whatever procedure was performed. The body is pretty incredible with how it can heal. And so we're trying to remove any sort of infection to let the body heal. I made it a personal point to always call a patient whenever I get them numb, whether that's for oral surgery or even just a simple filling. I always call them the next day and just make sure they're doing okay so that if a patient has any sort of issue, I can stay ahead of it. That way they're knowledgeable, and if they have a question, I can answer it easily and they don't have to wait till the next appointment or whatever. I just want to make sure that the patient feels like they're taken care of because I truly want them to be taken care of. So that's how I would want to be treated as a patient. So I've made that a very poignant effort to make sure that I'm doing the best for them and just communicating.